So it's my pleasure to have with us this afternoon a colleague of mine, Dr. Chris Herndon, who is professor of pharmacy practice at Southern Illinois University, Edwardsville. He is also a clinical associate professor in the Department of Community and Family Medicine at the St. Louis University School of Medicine. Dr. Herndon is recognized as an expert in pain management and palliative care. He has contributed to DePiro's pharmacotherapy text, and he's also been the president and a founding member of the Society of Palliative Care Pharmacists. He, in the last few years, has set up an NIH Center of Excellence in Pain Management at SIUE. He's recognized by the Illinois Pharmacists as a Pharmacist of the Year and also a distinguished alumnus of the St. Louis College of Pharmacy. And he's been recognized as a distinguished teacher over the past few years. So it's my pleasure to welcome Dr. Herndon.
Thank you, Dr. Poirier. I appreciate the honor of being involved in this project and am humbled to be included.
Thank you very much. So we'll start off, we would like to learn more about your journey as you've developed in your career and recognition as a leader in your field. And in responding to that, you may wish to include key events or persons who influenced you in your journey.
Well, thank you for that question. I actually, my journey was somewhat an unusual path. I chose to do a residency in geriatrics back a million years ago, when you chose to either do a general or a specialty residency versus PGY1, PGY2. And mine was at University of New Mexico. It was a geriatric specialty. And at that point in time, we were just starting to identify the longitudinal experience as part of residency training, where you would spend one full day from a continuity standpoint in various practice settings. And mine was actually in hospice and palliative care, which was 20 years ago, a very unique practice setting for a pharmacist. And it just so happened to be tied to the geriatrics residency. Probably the most profound impact on me choosing to go down this path was a physician who had started the palliative care program at New Mexico, and his name was Walter Foreman, a fairly well-recognized geriatrician, and was the founding president of what is now the American Academy of Hospice and Palliative Medicine. And he really took me under his wing and informed me that very few pharmacists do this. It's better to be a big fish in a little pond. Why don't you think about moving in this direction when you get done with training? And so he really was the one that pushed me along the way, especially in my early years directly after training, and trying to get me involved in different professional aspects of, back then, what was just an area of practice. It wasn't even recognized as a specialty yet. And so it was really instrumental in me being able to develop professionally as a pharmacist practicing in that area, because really there wasn't that many people doing it that could tell you that you were doing it wrong. I have to mention definitely the pioneer of pharmacy services and pain and palliative care, the late Arthur Lippman, who really paved the way for us and was part of the original United States Hospice Demonstration Project in Connecticut. And he really had a large impact on my professional development, as well as Dr. Foreman's. So the interesting piece of this is that my first academic appointment was with Texas Tech School of Pharmacy during their initial class recruitment. And I was actually hired to do family medicine there. And however, once I got there, that particular practice site did not pan out. And I was told to go find something to do, which is a pharmacist's dream come true, to be able to go out and just find something that is clinical in nature that you can host students. And so I split my time in Amarillo between a local not-for-profit hospice organization and a large multi-physician outpatient oncology center running their palliative care program.
Excellent, excellent. Thank you very much for that. So the next question I ask is, I'm going to ask is, what do you believe will be your legacy in 20, I'm going to say 30 years because you're relatively young. And when reflecting on that, legacy is a daunting term, and most people don't like to think of legacy because people say, I don't make a, well, you do make a legacy, but looking at all your activities and involvement and contributions, what are you most proud of in terms of your contributions to help advance the pharmacy profession?
Well, Terry, that's an interesting question. And actually, looking at the questions a little bit beforehand this interview, you know, I was reflecting on that, and my gut instinct initially was to answer that, you know, we worked really hard to get this specialty society off the ground to help promote the profession of pharmacy at the same time as advocating for our patients with pain and palliative care needs. However, honestly, the more I thought about that, I really think my legacy and the thing that I'm most proud of are the PGY2 residents that we have put out over the last 6 years. These professionals never cease to amaze me. They've long ago surpassed me in expertise and accomplishments and ambition and energy and passion and teaching students in our profession to get involved and to view this particular area as a very important competency versus just you know, an elective that you might think about you know, when you're trying to fill your course schedule up. So while I'd like to say the society is very important to me, what I'm absolutely most proud of is watching these young professionals assume leadership roles within the profession.
Great, excellent. Thank you for that. The next thing we'd like to hear from you is any advice you have for students in their professional journey. Professional journey, especially as they develop as leaders to help advance the profession.
That's a tough question. I think that, again, it's finding something that you're passionate about and that you truly enjoy, because, you know, as my dad used to say, if you like what you do, you'll never work a day in your life. And I really do enjoy the patients that I work with and the therapeutic areas that I work in. And so yeah, I think good advice to students is make sure that you keep your options open and that you keep your mind open about what it is you really enjoy doing. And once you identify that, it never hurts, and you should never hesitate in asking to do more. You know, can I get involved here? Can I help with that opinion paper? Would you like some help with this book chapter? You know, it may seem a little daunting, but most of the people who are now, you know, in our phase of our careers that have been doing this for a little while, there's nothing more rewarding or exciting than being approached by a young and very energetic professional that wants to get involved, wants to learn how to do these things, and ultimately, you know, be able to pick up where you left off. Most people never look at it as stepping on toes. It's really more of an opportunity to develop lifelong mentorship relationships. And I guess that's another important piece of advice that I have for students is make sure that you have strong mentors in various aspects. One mentor is never enough. You know, have a mentor when it comes to clinical decision making. Have a mentor when it comes to making professional decisions about your career. And they don't have to be the same person, but it should be somebody that you're very comfortable sitting down, talking to, and likewise hearing answers that you may not necessarily like as you ask them very difficult questions.
Excellent. Thank you very much for those words. So the other thing is some of these interviews will be embedded in a history and pharmacy leadership course as we study the decades of 2020. One of the key events, I believe, in that decade will be the COVID-19 pandemic. And like other key events in our history, key events external to us help to shape our profession and influence our profession. So how do you see that occurring with COVID-19 pandemic, not only shaping our profession, but being an opportunity for our profession?
Well, again, that's a tough question. And I think that, and I'm certainly don't claim to be the expert in this particular area, but I think that one of the biggest things that could have happened was our community colleagues being allowed to do the testing for this particular disease and do the reporting on that. I think really what will be the, I guess in my opinion, the icing on the cake that will really make or break, I think, us moving forward is some of the legislation that's currently being looked at right now about how do we pay these pharmacists from the federal or state level to do these cognitive services. So finally, we are involved in something that isn't tied to the sale of a drug or a product, and we're being looked at as healthcare professionals that have the expertise to handle this. But we have to make sure that we're also able to keep our doors open while we do that. I think another big important practice-changing component of COVID-19, it may not be directly related to the disease in itself, but I think the involvement of pharmacists practicing telehealth, telemedicine, virtual visits has really opened a lot of doors. And I really strongly think that things will never go back to completely the way they were after the pandemic in terms of the way that we deliver healthcare.
Excellent, excellent insights. Thank you very much. Chris, Dr. Herndon, it's always a pleasure, and thank you for sharing some of your time and sharing your insights and your journey. We really appreciate it.
Absolutely.
Thank you.
I appreciate the opportunity, and I hope that you have a wonderful weekend and stay safe.
Thank you.